Hello everyone, welcome to my channel. So this is my first educational video and I'm really excited for this. So I thought first I'll teach you materia medica, but I was really confused which remedy should I start with. So I had made a poll on Instagram and according to that I have prepared the remedy which maximum of you have chosen, but some of them have chosen other options also. Don't worry, I'll be telling you about that remedy also in subsequent videos, so stay tuned for that. Okay, so the remedy which I am discussing with you today is Aconite, right? So this video will be benefited for those who are reading this remedy or who are studying this remedy for the first time, or if you have already studied the remedy, then it can be a quick revision for you, or today you may even go through some of the new points which you may not have known before about Aconite, and also I have included the clinical aspect, that is clinically how can you apply this remedy, right? So both the theory as well as the practical, that is the clinical aspect, I have mentioned in this video. So whether you have studied this or not, you can always go to this video. It will be a quick brush up for you with the clinical tips, right? So without any further delay, let me start. So starting with the common name of the remedy, it is monk's hood or wolf's bane, and it belongs to the family Ranunculaceae, right? Okay. So next, coming to the very important point of this remedy, that is ailments from. See, Aconite is an acute remedy, and always in acute cases, right, ailments from or the causation becomes very important, right? So especially in Aconite, the causation is very important, and in that, first one is exposure to dry cold wind, and second one is checked perspiration. These two ailments are very important or very characteristic of Aconite. Okay, so what do you mean by checked perspiration? Checked perspiration means suppressed perspiration, that is suppressed sweating. For example, a person is sweating, right? Then suddenly he comes to a room where there is AC, or suddenly he takes a cold water bath. What happens? The perspiration is suppressed there. So after this, if the person develops some complaint, then you can think of Aconite. This is a very important causation of Aconite, right? So as I told, dry cold air, checked perspiration, then sudden violent emotion. It could be fright, fear, anger, excitement, or even excessive joy can be the ailment for Aconite. Okay. Also dry north or west wind. Okay, exposure to cold air while perspiring. Very hot weather can also be a causation in Aconite, especially for the GI complaints. So this is the ailments from. Okay, very important. Next, coming to the constitution. So how is Aconite person, right? So they are strong, robust people. They are plethoric. Okay, and there is sedentary habits. Okay, and very important you should remember is Aconite is acute remedy. It comes like a storm, goes like a storm. So that acute it is, very acute. Okay, so and they are easily affected by atmospheric changes. Then very important is calmness contraindicates Aconite. Whenever the patient is calm, okay, you can never give Aconite in such cases. Okay, I'll come to the mind of Aconite. We'll discuss it there. So next is the mind of Aconite, right? Very important is fear, anxiety, and restlessness. These 3 points is very important. Okay. So fear and anxiety. So there is fear of lot of things, of going out, of crossing the road, of going in a crowd, especially where there is excitement, right? And fear of dark, or fear of something or some misfortune will happen to him. They have a lot of fear. Okay, even fear of death is seen, and fear of death in Aconite is very characteristic. That is, they even predict the date and time of the death. They even call their friends, you know, fearing that they are going to die, so they want to talk to them for the one last time. So such is the fear of death in Aconite. Also there is fear of death in pregnancy. Okay, so whenever there is fear of death in pregnancy, you can think of Aconite. So due to this fear, the life becomes very miserable. Okay, because there is lot of fear. And music is unbearable. Music makes the Aconite patient sad. Okay, so as I told you, mind is very important, and in that, one is fear of death, anxiety, restlessness. That is why calmness contraindicates aconite. Okay, so please remember that. Next, coming to some of the characteristic symptom of aconite. So first, as I told, there is restlessness. It could be seen both mental as well as physical restlessness is seen in aconite. Then, with every complaint, fear, anxiety, and worry is associated. So, this is very important. When the patient may present to you with any complaint, but if it is associated with marked fear, anxiety, restlessness, and it is acute, you can very well think of prescribing Aconite to that patient. Okay. And pain is intolerable, especially at the night. They start screaming, shrieking with pain. Okay. Pain is absolutely intolerable. Then, Aconite, as I told, it is an acute remedy, so you can always think in first stage of inflammation, that is congestive stage of inflammation. Okay, first stage of inflammation, you can think of Aconite. And the one word which describes Aconite is tension. Tension both in mental as well as physical plane. Okay, physical means there is again congestion of the parts, that you can consider it as tension. Okay, then there is burning in internal parts. This is also important. So there is no periodicity in aconite. Okay, that is, complaint do not occur at a certain interval. It is not like that. It can come anytime, go anytime. This is aconite. Then there is only functional changes. Yeah, this is very important. So once the structural changes has begun, you cannot give aconite. Okay, so see, initial stage, as I told you, aconite is thought of in initial stage of diseases, right? So initial stages, the structural change will not start. It is just in the functional stage. Okay, where you can see initial complaints are associated with fear, anxiety, more of mental complaints, more of acute first stage. But once the structural changes has started, you cannot give aconite. Okay, keep this in your mind. Then thirst is very, very characteristic. So thirst is for large quantities of cold water. Okay, large quantities of cold water. Then it is also an hemorrhagic remedy. Okay, if there is sudden severe acute hemorrhage, especially bright red blood associated with the mind symptom of fear, anxiety, restlessness, you can think of aconite. Then there is sudden violent complaint. I have already mentioned that everything tastes bitter except water. This is very important. This clinically it is very rare to find, but if you find, then you can very well think of aconite, especially in acute cases or fever cases where everything tastes bitter except water. Think of aconite, right? Then facial paralysis from dry cold winds. You can think of aconite. Yeah, this is very important. Aconite has white stool and dark colored urine. Okay, this is one of the important point. Also, aconite has white coated tongue. Okay, then upper half of left lung is indicated. So you can think of aconite in lung condition wherever there is acute complaint or acute attack. Plus, if the upper half of the left lung is indicated, then it's a very good indication for you to prescribe aconite. Okay, so these are some of the characteristic symptoms. So other symptoms are anxious dreams. Okay, and yeah, this is very important. Rising from recumbent position. Recumbent position means when the person is lying down, and when he gets up from the lying down position, what happens? The face becomes pale. Okay, there is giddiness. The person becomes unconscious. Even there is loss of sight. Okay, and yeah, there can be even vertigo. So because of all these, there is fear of rising again. Okay, so all this occurs in a particular condition which we call it as hypotension, that is postural hypotension, especially when the person is lying down, and when he gets up from the lying down position, there is giddiness or weakness or paleness. This we call it as postural hypotension, right? So if the person is having acute episode of, acutely if he is having postural hypotension associated with fear. See, when you're prescribing any remedy, you cannot just prescribe based on one symptom. Minimum three symptoms, three characteristic symptom, or minimum three symptoms should be covered by that remedy. Only then it will act, right? Prescribing on one symptom, usually it is little bit risky unless it is the characteristic symptom, or unless the symptom is the one which defines the case. Otherwise, minimum 3 symptoms should match whenever you're prescribing a remedy. Please keep that in mind, okay? So, so every postural hypotension, you cannot go on giving Aconite, right? So with the postural hypotension, there should be these symptoms of paleness or whatever I have mentioned, plus fear, anxiety, restlessness should be there, or anything, any symptom which uh, is there in Aconite. Only then you can prescribe Aconite. Not in every case of hypotension you can prescribe Aconite. Okay. Yeah. So cough, there is cough in Aconite which is dry and especially on loud, and I mean it is loud on expiration, right? So expiration aggravation is there. Then amenorrhea from fright. I have already told you that fear, fright is one of the main causation. So it can also lead to amenorrhea, or it can also lead to abortion in a pregnant women, right? Yeah. So convulsion of teeth in children with fever, and there is twitches of single muscle. So you can always think of convulsion in the dentitional period with fever, with twitching of single muscle, with other symptom of Aconite. Okay. Then retention of urine from shock. Okay. So again, this comes under ailments of shock, fright, or sudden emotion. Okay, so it can lead to amenorrhea, it can lead to abortion, it can lead to retention of urine. Okay. Yes. Then complaint from haircut. You may know some of the famous remedy for this is belladonna or gluconine, but Aconite also has complaints from hair. It is not well known, but it does have this symptom, right? So whenever there is an very acute complaint after haircut associated with other like fear, anxiety, I'm repeating this because it is very important. Okay, calmness contraindicates Aconite, so you have to remember that whenever there is acute episode with these characteristic mind symptoms, you can think of Aconite. That's why I'm repeating it again and again, okay, so that it sits in your mind. Yeah. There is sciatica, and the characteristic of sciatica in Aconite is with sciatica there is numbness, or first there is pain of sciatica followed by numbness. Understood? That is pain with numbness or pain followed by numbness. Okay, that is there in Aconite. Then white coated tongue, I have already told you. One more thing you should remember is, I have already mentioned this, white stool and dark colored urine. Okay, you can think of Aconite. Aconite is called as homeopathic lancet. This can be your important AIA, PGT or MCQ question, right? Homeopathic lancet, which remedy is called as homeopathic lancet? That is Aconite. Okay, so this question they can ask in your competitive exams or in your MCQ type of exams. Okay. Yeah. Next, coming to the very important thing of Aconite is fever. Okay. Again, some of the main symptoms should be a sudden onset of fever. Ailment from is very, very important. It could be from dry cold wind or sudden emotion or suppressed checked perspiration. Okay, ailment is very important. You have to see for the ailment. You have to see for the acuteness or suddenness. Then during fever, what happens? There is dry hot skin. Okay, there is dry hot skin, and then there is burning of the whole body. I mentioned this earlier also, right? There is burning of whole body, but you can also see profuse perspiration. Okay, profuse perspiration. Then coming to the pulse will be full, right? Hard, frequent. Okay, full, throbbing, frequent pulse will be there. When you see the face, it will be red and pale alternately. Okay, red and pale alternately. Thirst is very important during fever. Large quantity of water for cold water. Yeah, thirst for large quantity of cold water. This is very important. Then, yeah, other symptoms, that is restlessness. Again, the person tosses in agony. Now, what is agony? Agony is pain or suffering, right? So the person is very restless. He cannot sit in one place. He tosses due to pain or the suffering. And this restlessness is more in the evening. Even if there is any pain, it is intolerable. Okay, the patient shouts, shrieks with the pain. Then there is sadness in chill and heat, and the person is very sensitive to light and noise. Okay, so this is about the fever of Aconite. Now I'll give you some of the tips regarding Aconite. So the first one is, do not give aconite in initial stage of fever just because it is the first stage of fever. Please keep this in your mind. The symptoms should match. Only then you can give. As I mentioned earlier, minimum 3 symptoms should match, right? Because if you think that, so okay, this is the first stage, I'll give aconite. After this stage, if the symptoms are there, then I'll go for some other remedy. It will not work like that. If it is an aconite fever, then what will happen is only aconite will solve the case, right? And for that, what should be there? The symptom similarity should be there. That to minimum, again I'm repeating this, minimum 3 symptoms should match. If it is a typical aconite fever, it will be cured with only aconite. You will not need any other remedy. Okay, so prescribe aconite in fever only if the symptom matches. Otherwise, forget about aconite, think of other remedies, right? Not just because if it is a first stage, you can think of aconite. That is not, that should not be done. Okay, it should be given only if there is symptom similarity, right? Then Kent has told 2 important things about aconite. Among that, first one is, aconite is like a great storm. It comes, sweeps over and passes away. So that acute, that sudden is the symptom. Okay, or that sudden is a complaint in the patient. So remember this. And the next one he told is, never give aconite in blood poisoning, such as in scarlet fever or typhoid. So this is what he has told. This is his saying or his experience. Okay, yeah. And clinically, it is a specific remedy for aphonia, tonsillitis, croup, or other inflammatory diseases. Again, it is not that in every case of aphonia or every case of tonsillitis you will think of aconite. Symptom similarity should be there. Then you can give it in these cases if the symptoms match. Okay. Yes. So when I say symptom, important thing in aconite you have to see first is the ailments. Very, very important. Then the mental state. That is the fear, anxiety, restlessness. Right? Then you can see for the modalities or thirst or any other characteristic symptom. But the very important thing in aconite is the ailments from the mental state, the modalities, thirst, and other symptoms which I mentioned, the characteristic symptom. Okay, fine. Let us see the modalities now. So aggravation, evening, night, rising from lying down position, right? Warm room, lying on affected side, music. As I told, music makes them sad, right? And dry cold wind. So these are the aggravating factors. Amelioration from open air, after perspiration and uncovering. Okay. Aconite forms a trio of 2 things, trio of restlessness and trio of pain. So I'll be differentiating the remedies in the subsequent videos or shorts, but today here I'll mention the remedies. Okay. So trio of restlessness is aconite, arsal, restox. Trio of pain is aconite, coffea and chamomilla. Okay. So clinically or clinical point of view, what you have to remember about aconite is the suddenness, acuteness, ailment, which is very important, and in that the most important is dry cold air and suppressed perspiration also from sudden emotions. Okay, that is very important. The mental state, that is any complaint should be associated with fear, anxiety, restlessness. Calmness contraindicates aconite. You have to keep this in your mind, right? Thirst is very important or very peculiar, especially in fever, right? And the pain. Okay, pain is intolerable, shrieking with pain. Then the hemorrhage, bright red bleeding associated with fear, anxiety, restlessness, right? And thirst I mentioned. Then the modalities. So these things clinically you have to remember about aconite. So that's all about aconite. So one thing I want to tell you is, in acute cases, please remember ailment factor is very important. The mental state, that is after the illness. Okay, what is the mental state of the person, that becomes very, very important. The modalities becomes very important in acute cases. So aconite is obviously an acute remedy, so all these symptoms will become very important whenever you are prescribing aconite. So I hope you got an overall idea about aconite, both the theory as well as the practical aspect, and I hope you will be able to remember aconite could be in your exams, could be in your viva, or could be in your clinic when the Aconite patient comes to you. I hope this picture stays in your mind, and I hope you have understood about Aconite. If you have any doubt, or if you want me to improve my teaching or change my method of teaching or anything which you want to suggest me, I'm open for that. You can let me know in the comment section below. Even if you have any doubt, please feel free to ask me. Let me know in the comment section below. And thanks for watching. Share this video among friends or fellow homeopaths if you think that it will help them, right? And yeah, I'll be coming up with much more videos, educational videos. So stay tuned for that.